Dr. Alo joins us this morning on 107.7 The Wolf. We're going to talk a little heart disease. It's red. We got to wear red. It's time for the red. You got your red on. It's time to recognize it. More in women, Doc, right? I mean, this is what we're going to hit this morning.
Right. The whole point of this campaign is to raise awareness about heart disease in women. Unfortunately, in the past, we didn't recognize it early enough, or we ignored it. Women weren't treated as aggressively as men were, and a lot more women used to die of heart disease or heart attacks than men. For example, in 1984, more women died of heart disease than men. Those numbers have come back to normal, and now less women die every year, about 48% compared to about 52 of men. Not that that's good.
No.
People have started dying less and less of heart disease overall because we got better medications, better treatment options. But we've raised awareness enough. We've gotten more aggressive with treating women the same way we treat men, and we've been able to kind of even that out and bring it back to normal.
Why wasn't people aware of it, you think, back in the day? And we're being more aware of it now, more conscious of it now.
Well, previously, it was thought that, normally women get heart disease about 10 years later than men.
Why is that?
Because the estrogen, we think, has a protective effect on women. So men usually it starts showing up around 55, women 65 or older. So we kind of ignored it. We put it on the back burner. Women also don't get chest pain the way men do. They don't present in the same way. They don't get that, crushing chest pain shooting down their arm. So people didn't recognize it fast enough. We weren't aggressive enough about treating it. All the studies that they used to do on heart disease and heart attacks, women were very poorly represented in those studies. Only about 24% of people included in those studies were women. Now we're back up to 50-50. So a lot of that was just ignorance and just not knowing how to treat it or when it is, recognizing that it is actually heart disease.
Where's your office now? Where are you located?
Well, we have a number of locations.
Okay.
Our main one is on Cherry Street here,
Okay.
sort of next to you. We also have one in Sylvania and King across from the Kroger there.
Gotcha. So, questions about this, because it's always interesting, the heart disease with me, because I've had family members go through it. I've had male and female go through it. Why is it that because that was one of my questions. Why is it different symptoms for a woman than it would be for a man? Like you said, a man like feels shooting pain, and a woman doesn't feel like a man does, right? It's a different take on them.
They might. I mean, they
might,
might
but
feel
not
the
as
same
often,
way,
right?
but not always.
Okay.
They might get things more like shortness of breath or easy fatigability, an inability to walk as far as they used to be able to, different kinds of symptoms. It's not always the chest pain,
Mm-hmm.
that dull, achy, squeezing chest pain that's relieved with rest, or the chest pain going into your arm or neck or jaw. It's a little bit different. Some people present just the same as men, but unfortunately a lot of times they don't, and it's hard to recognize.
To prevent it, that's always a good question. To prevent it. See, I'll throw me out there. I run a lot. I'm a runner. I run 6-7 days a week sometimes. Does that help me? Or does that, even if might run in my family, that still help me out?
That definitely helps.
Okay.
The most important thing you
is your
can
diet,
do,
of course.
No, the most important
Really?
thing you can
See,
do.
that's why I'm not a doctor, people.
The most important thing you can do is
Yeah.
to quit smoking. All those other
That's
things
number
make
one.
a huge difference, but quitting smoking in and of itself reduces your heart attack and cardiovascular risk by like 20 times.
Really? It's that high?
Yeah, so quitting smoking in and of itself
Cigars?
is the biggest.
I got to get off the cigars,
You
Doc?
should get off the cigars.
So cigars is not a good thing. So
Cigars, hookah, cigarettes, any kind of
Really?
smoke going down into your lungs. You got to quit that. Healthy diet, exercise, like some of the things you mentioned, are all excellent as well, and they all help. Since we started this campaign, this is a 10-year anniversary of the Go Red, Awareness for Women campaign. Since we started the campaign, about 15% decrease in the amount of women that smoke, and their cholesterol levels are down 18%.
That's awesome.
So that's really good. So
Yeah.
they're recognizing that it is an issue. It is the number one killer. Heart disease kills more women than all cancers combined. So it's a huge it's the number one killer, men and
Yeah.
women. But for women, we always look at, breast cancer, and you see the pink in October, and everyone's talking about breast cancer awareness. 1 out of every 31 women that dies this year will die of breast cancer. 1 out of 3 will die of heart disease. So it's very important to keep that awareness high. People have to lose weight. They have to quit smoking. You got to get your cholesterol checked, your blood pressure, all those things, and get them all down. I think it's very important,
Yeah.
and we need to try to talk about it as often as we can.
So tell me a little more about the Go Red campaign you got going here, Doc.
So the Go Red campaign, it came up about 10 years ago. In the late 90s, we recognized that we have severe issues with, not recognizing chest pain in women and heart disease in women and cardiovascular disease in general in women, and they were ignored, and we weren't treating it aggressively. So in about 2004, they came up with this campaign to raise awareness, and it's done a tremendous job. The website that we have used to get about 300 to 400,000 visits. Now we're up to almost 60 million.
Yeah.
So it's been very effective. About 37% of women have recognized that they need to lose weight. Back in the late 90s, only 30% of women correctly identified heart disease as the number one killer. Now it's up to almost 60%.
That's a big number.
It's a huge increase. If you ask 60 out of 100 women, they'd all correctly identify heart disease as the number one killer. So we've made a huge inroad into identifying that this is the number one killer, and we need to do something about it.
Yeah, absolutely. Now, being a cardiologist, doing what you do for a living,
Sure.
how tricky is it for you to diagnose? I mean, that's an interesting what you do for a living. How tricky is the heart for you to diagnose somebody that comes in? Can you catch right away what's going on with somebody?
Well, if they're presenting normally, like the classic symptoms with, dull, achy, squeezing chest pain going down your arm and shoulders and back and all that, then, it's pretty easy to pick up. But
Because there's some people that come in and you're like,
right.
Yeah.
Some people come in and you don't know. Luckily, we have a blood test now that's very, very accurate. It tells us, either heart attack yes or heart attack no. And that tells us whether you're having an active heart attack right away. It doesn't tell us if you have stable plaques in your arteries. If you have blockages in your arteries that are stable, it doesn't identify those. But if one ruptures and causes a heart attack, we can identify that with a blood test now. So it's very accurate.
Is there anything you can do, before you actually have to hit the doctor, that you could do that you might be able to recognize yourself, or do something other than smoking, non-smoking, and diet and exercise, where you can actually check yourself, make sure you're okay? Or should you get regular checkups?
The most important thing is to know your numbers. Go to your doctor.
So yeah, just
figure
make
out
sure
what
you do your
blood
appointments.
pressure is
Right.
and your cholesterol, and then your family history is key.
I was going to ask you that.
Cholesterol is a genetic problem. If you did everything right, if you ate right and exercised and did everything right, you could reduce your cholesterol by about 16%. In the best studies, people were able to reduce it by 18%. So somewhere in that range. So most of it is genetic. And the only way to get that down usually is with medication. So you could exercise and run all you want. You'll reduce it by 16%. But know your numbers. Know your cholesterol. Know your blood pressure. Your blood sugars are huge. If you smoke, obviously quit. Know your family history. All those contribute to your genetics.
What about, you get your blood pressure taken, and let's say you have high anxiety or something like that. Can that affect you and your heart and cause you to have a heart attack?
Sure, anxiety
Yeah.
and stress definitely
Yes.
cause instability of those plaques in your arteries, and they can rupture. Even just running one day could do that if it's unstable. That's why you got to know your numbers, and if you need to be on cholesterol medicine, that helps stabilize those plaques and cause them not to rupture in the future.
Really? So I didn't realize that that could be such a problem in your life. Is there any way you can treat that? Because there's always somebody they're anxious, or they have.
Well, you can if you're an anxious and stressful person, you got to do things that relieve stress. For some people, it's reading or running or exercising or just relaxing, going on vacations.
Drinking? No, I'm just kidding.
Drinking can relax you.
But that's bad for the heart.
But alcohol
yeah, that's another
is
bad
a
killer.
toxin for your heart, yes.
That was a joke, Doc. That's what I do here. I goof off a little
I'm
bit.
glad. I like
but
doing that.
people will think that that's a good way to relax, where they got to go home and they have a glass of wine. Is that something that is good to have each night? That's what I was leading to.
A glass of wine every
not gonna
night
hurt you?
is not going to hurt. In fact, it has some properties that raise your good cholesterol.
That's what I was going to ask you.
Which is usually a good thing.
Yeah.
Very few things raise your good cholesterol. One of them is exercise. One of them is a B vitamin called niacin, and one of them is a little bit of wine. Now, don't drink excessively, because
Don't drink the entire bottle, but
Right.
but a glass is good.
Yeah, because then it becomes a toxin, and then it hurts your heart.
Right.
So,
Now, how long have you been doing this?
doing what?
Do you-
Medicine in general, or just cardiology?
Cardiology.
Cardiology for the last 4 years.
You enjoy it?
I love it.
I tell you, this guy is a young guy, 2 years. So where's your offices again?
Well, you can go to ToledoCardiology.com.
How do they get a hold of you, Dr. Alo?
You can go to ToledoCardiology.com. You can call our number 419-251-3700. make an appointment, get your numbers checked out. You know, we'd love to prevent heart disease. Unfortunately for us, we see patients after they've had a heart attack or stroke, and we're playing catch up. But we'd love to see people when they're younger and healthier. They want to lose weight, they want to quit smoking, they want to get active. I'd love to have more patients like that. I think that's the best way to do it.
That's
is
what I
to
was going to
prevent
ask
all
you.
these things.
If you have any patients now that haven't had any heart attacks, will come in and see you just to make sure they're okay, that's a good thing to start in your life.
That's a very good thing to start. I have a lot of patients that come in mainly for weight loss, for smoking cessation.
So you help people lose weight and stop smoking as well. That was my next question to you too.
Definitely.
So they can come in and start that. And also, if you want to go on a regular basis to go get checked up, what's a good amount of every month, every couple months to get checked out to make sure you're okay before, because you said you always treat them after they have a heart attack.
Right.
And you want to treat them before they have the heart attack.
We recommend that kids, even pediatrics, by about age 12 or 11, they get their cholesterol checked. And then,
really, that young?
Right, just because there are certain genetic cholesterol levels that we can't, that has nothing to do with being a kid or eating poorly. It's just something genetic that's really bad. But normally for adults, we say at age 20 you should get your cholesterol checked once. And then after that, it just kind of depends on what we find. But about once or twice a year, you should see your doctor for the average person over 25. And even if it's just, hey, how do I look? Get some blood work. What's my thyroid looking like? What's my heart looking like? Cholesterol, blood pressure, blood sugars. Those are all things that the sooner we treat them and get rid of them, the better you're going to be. All the complications of diabetes and heart disease go away if we treat it early and get your numbers down to normal.
Excellent. All right, so let's go red, and we're making women aware of this because
men and women.
Well, men and women, but more women. You said, of course, men. We all. I got to tell you, I always worry about it. I mean, because I think I always thought more men had heart attacks, but that's not the case, Doc.
It's not the case.
No.
It's about 50-50. About 600,000 people a year will have a heart attack. Half of them.
How many?
600,000 a year will have.
That's a big number.
Actually, I'm sorry. 750,000 heart attacks per year. About half of those are women. 525,000 of them are new heart attacks. So all the rest are repeat offenders. If we could prevent those 250,000 extra ones, that would be really nice.
Is that hard to do? To when you have a heart attack, is it you're more likely to have another one?
You are, but if we get your bad cholesterol down and you quit smoking, we could make a huge difference. The problem is people continue to smoke and
eat bad and not see their doctor.
Not take their medications.
Yeah, now you got to go see your doctor.
You got to see your doctor and actually do what they say.
That's another one. You say, hey, this is what I want you to do. Follow these steps and eat this way and don't smoke. But they still go out and do it. A lot of them, right?
The problem is quitting smoking is very hard.
Yeah, it's hard.
It's the most addicting substance we know of, and it's not easy. I mean, most people try to quit 10, 11 times before they really quit.
Jeez, that's a lot.
It's very hard. It's very addicting. Those cigarette companies knew what they were doing.
Yeah. Oh, yeah. I mean,
it's more addicting than cocaine, meth, crack, heroin, all that stuff.
Yeah,
it's impossible to quit.
I used to smoke cigars on a regular basis, and my father passed of cancer, and he said, "Now stop." And even though we're talking about the heart, he goes, "It's bad for your heart. It's bad for everything." So I haven't smoked. I mean, I smoke one occasionally. That's not going to hurt you, right?
It will, actually.
You're not supposed to tell me that, Doc. So don't smoke them at all. Don't smoke, period.
Don't smoke at all.
Don't smoke a cigar, even like on the Super Bowl a few days ago when I had a cigar. That's bad.
Once a year, maybe.
You're not even saying that.
No.
All right. So Go Red. It's going on one more time. Tell us a little more about Go Red, and then we'll move on.
The Go Red campaign is to raise awareness about women's heart disease. We want everyone to be aware of it. Unfortunately, too many women die or are ignored or they don't know the symptoms. We want people to be more aware of it. Anytime you feel something in your chest pain, squeezing, dull, achy pain, or you get excessively short of breath when you don't think you should be, definitely get it checked out. Talk to your doctor, go to their office or the emergency room if you have to. But too many people suffer sudden cardiac death outside of the hospital because they ignored symptoms. They waited 2-3 hours and it's too late by then.
Doctor, Alo, I appreciate you coming in this morning.
All right.
Take care of your heart.
Thanks for having me.
Anytime.
I like your station, by the way.
You listen to 107.7 The Wolf?
I started this morning and I like it.
Not bad, huh?
Not bad
We
at all.
entertain, don't we?
Yeah.
Be good, Doc. Have a great weekend.
Thanks a lot.
Thanks.